Welcome to the Luck Scout Psychology. We all have our ups and downs, but what happens when the downs become overwhelming? This is the reality for millions struggling with mood disorders. These conditions, often invisible, cast a long shadow on every aspect of life. Mood disorders don't discriminate. They affect people of all ages and backgrounds. They are real medical conditions deserving understanding, compassion, and effective treatment. Imagine a spectrum of human emotions. On one end, joy and euphoria. On the other, sadness and despair. For most, emotions fluctuate naturally, like gentle waves. However, for those with mood disorders, these waves can become extreme and unpredictable. Major depressive disorder casts a long shadow over those it touches. It's more than just feeling sad. It's a profound state of despair. Imagine waking up with a heavy weight on your chest, making it difficult to face the day. The world can feel bleak, colors muted, and joy elusive. Symptoms include loss of interest, changes in appetite or sleep, fatigue, and feelings of worthlessness. In severe cases, it can lead to thoughts of death or suicide. Major depressive disorder often isolates individuals from those who care about them. The stigma surrounding mental health prevents many from seeking help. Trapped in their minds, they withdraw from social interactions and passions. This isolation exacerbates symptoms, creating a vicious cycle. Relationships and careers suffer as loved ones struggle to understand their pain. Breaking free requires a multifaceted approach, including medication and psychotherapy. Despite the challenges, hope exists. Recovery is possible with the right support. The first step is acknowledging the need for help and seeking professional guidance. Confiding in a trusted friend or healthcare provider is crucial. Mental health professionals provide the tools and support needed for recovery. Treatment typically involves psychotherapy, medication, and lifestyle changes. Imagine a roller coaster, its tracks twisting through the sky. This is the essence of bipolar disorder, characterized by dramatic mood shifts. Unlike typical ups and downs, these swings are extreme and disruptive. Individuals cycle between periods of mania and depression. During mania, they may experience a surge of energy and racing thoughts. In contrast, depressive episodes bring overwhelming sadness and fatigue. The stark contrast makes bipolar disorder challenging to manage. Bipolar disorder manifests in different ways. Two primary types are bipolar 1 and bipolar 2 disorder. Bipolar 1 involves severe manic episodes, often requiring hospitalization. Bipolar 2 involves hypomanic episodes and severe depressive episodes. Accurate diagnosis is crucial for effective treatment. A thorough evaluation by a mental health professional is essential. Living with bipolar disorder requires resilience and a strong support system. Effective treatments and coping strategies can help individuals live full lives. Treatment involves medication, psychotherapy, and lifestyle changes. Mood stabilizers and antidepressants help regulate mood swings. Psychotherapy helps individuals understand and manage their condition. Lifestyle modifications, such as regular sleep and exercise, are essential. Beyond major depressive and bipolar disorders, there are other mood disorders. Cyclothymic disorder involves chronic mood fluctuations. Persistent depressive disorder involves a chronic low mood. Disruptive mood dysregulation disorder affects children with severe temper outbursts. Recognizing and addressing these conditions is crucial. Each has its own unique symptoms and challenges. Cyclothymic disorder involves ongoing fluctuations between hypomania and mild depression. It's like being on a perpetual emotional seesaw. Periods of heightened energy give way to episodes of low mood. Relationships and work performance may suffer. Despite the challenges, cyclothymic disorder is treatable. Psychotherapy helps individuals manage mood swings and develop healthier coping mechanisms. Imagine a persistent drizzle, a constant grayness that hangs heavy in the air. This is the experience of living with persistent depressive disorder, a chronic form of depression. Symptoms may not be as intense as major depressive disorder, but are incredibly draining. Individuals may feel constant sadness, hopelessness, or emptiness. They may experience changes in appetite, sleep patterns, fatigue, and low self-esteem. These symptoms can permeate every aspect of their lives. The chronic nature makes it difficult to recognize and address. Individuals may accept their low mood as normal. They may not seek help, believing their symptoms aren't severe enough. Any level of persistent emotional distress deserves attention and care. Treatment involves psychotherapy and medication. Psychotherapy helps identify and change negative thought patterns. Antidepressants can alleviate symptoms like low mood and fatigue. Lifestyle changes, such as exercise and a healthy diet, also help manage symptoms. Childhood is often idealized as a time of innocence, joy, and carefree exploration. However, for children grappling with disruptive mood dysregulation disorder, DMDD, this period can feel like navigating a constant storm of intense emotions, marked by severe temper outbursts and chronic irritability. Imagine a volcano, its molten core bubbling with rage and frustration, erupting without warning and leaving devastation in its wake. Children with DMDD experience temper outbursts that are far beyond typical childhood tantrums. These outbursts are often disproportionate to the situation, both in terms of their intensity and duration. A minor frustration, such as not getting their way, can trigger a torrent of rage, verbal aggression, or even physical aggression towards themselves or others. These explosive outbursts are often accompanied by a persistent state of irritability and anger, making it challenging for children with DMDD to regulate their emotions and navigate social interactions effectively. They may have difficulty making and keeping friends, struggle to focus in school, and experience frequent conflicts with authority figures. The chronic stress and emotional dysregulation associated with DMDD can have a profound impact on a child's development, affecting their self-esteem, academic performance, and overall well-being. Recognizing and addressing DMDD early on is crucial for promoting healthy emotional development. Treatment typically involves a combination of psychotherapy, parent training, and sometimes medication. Cognitive behavioral therapy, CBT, can help children identify triggers for their outbursts, learn coping mechanisms for managing their anger, and develop healthier ways of communicating their needs and feelings. For many women, the days leading up to their menstrual cycle bring about familiar physical and emotional changes. However, for some, these changes are far more severe, casting a dark cloud over their lives. This is premenstrual dysphoric disorder, PMDD, marked by debilitating mood swings and irritability. These feelings can interfere with daily life, affecting relationships and work. Many women suffer in silence, unaware that PMDD is a treatable medical condition. As the days grow shorter and the nights grow longer, a noticeable shift occurs in the natural world. For some, this transition ushers in a period of emotional darkness. This phenomenon, known as seasonal affective disorder, or SAD, is a type of depression that follows a seasonal pattern. Living with PMDD or SAD can feel like navigating a constant battle against the rhythms of your own body or the cycles of nature. However, it's important to remember that you are not alone, and that effective treatments and coping strategies can help you reclaim your well-being. Seeking professional help is crucial for accurate diagnosis and ongoing support. Imagine a garden, overgrown and neglected. Weeds choke the once vibrant flowers, their petals wilted and drooping. The soil is dry and depleted, lacking the nutrients essential for growth. This is akin to the state of mind and body affected by a mood disorder. Healing requires a multifaceted approach, one that addresses not only the symptoms, but also the underlying causes, nurturing the individual back to health and vitality. Just as a gardener carefully tends to their plants, providing water, sunlight, and nutrients, treating mood disorders requires a tailored approach that considers the unique needs of each individual. There is no one-size-fits-all solution, and what works for one person may not work for another. The journey towards healing often involves a combination of psychotherapy, medication, and lifestyle changes, each playing a crucial role in restoring balance and well-being. Psychotherapy, the cornerstone of mood disorder treatment, provides a safe and supportive space for individuals to explore their thoughts, feelings, and behaviors. Through various therapeutic approaches, such as cognitive behavioral therapy or interpersonal therapy, individuals can gain valuable insights into the underlying causes of their condition, challenge negative thought patterns, and develop healthier coping mechanisms for managing life's challenges. Medication, while not a cure-all, can be an invaluable tool in alleviating the debilitating symptoms of mood disorders, such as depression, anxiety, and mood swings. Antidepressants, mood stabilizers, and anti-anxiety medications work by adjusting the balance of neurotransmitters in the brain, chemicals that play a crucial role in regulating mood, sleep, and other essential functions. Finding the right medication and dosage is often a process of trial and error, requiring close collaboration between the individual and their healthcare provider. Imagine a sculptor, their hands skillfully molding clay, shaping it into a work of art. This is akin to the transformative power of psychotherapy in reshaping thoughts, feelings, and behaviors. Through a collaborative process between therapist and individual, psychotherapy provides a safe and structured environment to explore the root causes of emotional distress, challenge negative thought patterns, and develop healthier coping mechanisms for navigating life's challenges. Cognitive behavioral therapy, or CBT, one of the most widely researched and effective forms of psychotherapy, focuses on the interconnectedness of thoughts, feelings, and behaviors. CBT therapists help individuals identify and challenge negative thought patterns, known as cognitive distortions, that contribute to their emotional distress. By learning to reframe these distorted thoughts, individuals can shift their perspective, reduce negative emotions, and engage in healthier behaviors. Interpersonal therapy, or IPT, another effective form of psychotherapy, focuses on the role of relationships in mental health. IPT therapists help individuals understand how their relationships with others can both contribute to and alleviate emotional distress. By improving communication skills, setting healthy boundaries, and developing more fulfilling relationships, individuals can experience greater emotional well-being and a stronger sense of support. Other therapeutic approaches, such as psychodynamic therapy, mindfulness-based therapy, and family therapy, offer unique perspectives and techniques for addressing mood disorders. Psychodynamic therapy delves into unconscious processes and past experiences that may be influencing current emotional distress. Mindfulness-based therapy cultivates present-moment awareness, helping individuals observe their thoughts and feelings without judgment, reducing reactivity and promoting acceptance. Family therapy addresses the interconnectedness of family dynamics and individual mental health, fostering communication, understanding, and support within the family system. The journey of recovery from a mood disorder is not a straight line. There will be ups and downs, moments of progress, and setbacks along the way. However, it's important to remember that recovery is possible, and with the right support, individuals can reclaim their lives and experience lasting well-being. Finding hope, embracing self-compassion, and cultivating resilience are essential components of this transformative journey. One of the most empowering steps individuals can take on their recovery journey is to educate themselves about their condition, treatment options, and self-care strategies. Knowledge is power, and understanding the nature of mood disorders can help reduce stigma, foster self-compassion, and empower individuals to advocate for their needs. Connecting with others who have lived experience with mood disorders through support groups or online forums can provide a sense of community, validation, and hope. Embracing self-care practices is essential for managing the symptoms of mood disorders and promoting overall well-being. Regular exercise, a balanced diet, adequate sleep, and stress management techniques, such as meditation or yoga, can have a profound impact on mood, energy levels, and resilience. Engaging in activities that bring joy, purpose, and connection, whether it's spending time in nature, pursuing a hobby, or connecting with loved ones, can nourish the soul and foster a sense of hope. Recovery from a mood disorder is not about achieving a state of perfect happiness or eliminating all challenges. It's about learning to navigate life's ups and downs with greater resilience, self-awareness, and compassion. It's about embracing the journey, celebrating small victories, and never giving up on the pursuit of a brighter, more fulfilling future. We've journeyed through the complex landscape of mood disorders, exploring depression, bipolar disorder, and lesser-known conditions. These conditions touch every aspect of life, affecting thoughts, feelings, behaviors, and relationships. We've witnessed resilience, hope, and the transformative power of treatment and support. Understanding mood disorders is about recognizing the humanity behind the labels. It's about empathy, support without judgment, and challenging stigma. With understanding, we open doors to compassion, connection, and healing. Greater awareness, early detection, and access to quality care can mitigate negative consequences. Our exploration of mood disorders has illuminated the profound impact these conditions can have on individuals, families, and communities. But it has also revealed a beacon of hope, a reminder that recovery is possible. Now, it's time to translate understanding into action, to create a world where mental health is valued, supported, and prioritized. We are all called to be agents of change, to challenge stigma, and to advocate for increased access to mental health care. Let this be a call to action, a reminder that we all have a role to play in creating a world where mental health is valued, supported, and prioritized. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.